It's nice to be here. I'm accompanied with my colleague, Samantha Mills, Sammy. And if you're here for this afternoon session, Sammy's supporting the practical session. Just wanted to say that I think we've been invited here today because we were perhaps one of the first users of a dolphin mattress in a more proactive way. So we use them currently largely as a preventative strategy before there's even a mark on the patient's skin. That said, this presentation, while it will make reference to the dolphin mattress, the ideas that I'm going to talk about are really quite generic principles. Now, I appreciate that a lot of people in the audience and online may be experienced in writing business cases or proposals. So apologies for if I'm teaching people to suck eggs on that one. If you are experienced, this as a refresher, but there will be some people who've maybe not been involved in that type of thing. So just a few things to consider. So this session will talk about the different steps that we took our story in using a specialist surface in a proactive way. We developed a protocol for its use, so we'll talk about that and how we adopted that. And of course, it's important to always, when you're thinking about introducing a new product, to plan the outcome measures that you're going to be capturing. All too often, we've been involved in innovations and quality improvement projects, and we consider that a little bit too late. So we need to have those thoughts at the start of the session, and then a sum up at the end. Apologies if I keep looking left. The font on this screen is really, really small. Jackie, I don't know how you did it. If there was a way of making that a tiny bit bigger. So before I start talking about the items to include in a business proposal, just a nod to COVID, really. It's not that long ago, and we are now seeing that some impacts of COVID. Of course, we've always had higher risk patients who bring their own comorbidities and risk factors. Oh, thank you. I'm a little hoarse. Thank you very much. So patients who bring their own risk factors. But with COVID, over half of the population develop COVID. How many in the room have had COVID at some point? More than half. And millions of people also developed symptoms of long COVID. During COVID as well, you'll know of some family or friends, or even yourself, who didn't seek medical treatment for a condition because we all experienced the challenges of doing that. It was hard to get to see a GP. Some people will have felt clinically vulnerable and wouldn't have wanted to attend a GP surgery. And as such, disease processes will have worsened in that time. We work in a specialist heart and lung centre, and we've certainly seen cardiovascular disease worsen during that time. And as a result, a lot of our patients who we're seeing now for planned or emergency surgery are sicker, and they are spending longer in hospital and longer in our intensive care units. And for those who work in the acute sector, might be seeing a similar thing. The World Health Organization acknowledged that in 2022 in that Where's Health prolonged recovery. So that makes sense. This is an extract from our business case when we were talking about introducing dolphin mattresses in a proactive way. So we all work in organisations where we step up and step down. So we upgrade a mattress and then the patient becomes clinically improved, and then we step down. We wanted to use a surface, an earlier opportunity. So we were thinking about patients, and sometimes it's just one patient who acts as a driver for change. In this case, it was one patient, and it was a young patient. Do you remember this patient, Sammy? Young woman, 32. Yes. She's saying yes. I don't know if she does, but I remember her very clearly. She was 32. She had twins. Yes. And she developed multiple sites of pressure damage when she was in theatre. So she was an aortic patient, an emergency patient, life-threatening condition. And our aortic patients are on the theatre table for hours, so sometimes 24 hours or longer. And it did strike a chord because she had two young children and she was having life-changing, life-threatening surgery. And she developed, the highest category she developed was a category 3. So they were decent pressure ulcers, but they were recoverable. But it did strike a chord. There's lots of national drives of pressure ulcers. It's always high profile. So whenever you're looking to reduce pressure ulcers, you usually have a good audience, a receptive audience. So this one patient was our driver. So that was our opening statement, really. What 10 years ago this was. So what we didn't do at the time was use clinical photography, which we now all potentially have access to, and a picture can be very, very powerful. So we put in a description about the mattress. So in this case, fluid immersion simulation, reactive system, and we talked about how it displaces the weight and the mass, simulating a fluid environment, simulating a waterbed in effect, and what it aimed to do to significantly reduce the pressures. So when you are thinking about a business case or a proposal, you need to potentially initially identify your key stakeholders. Now, all a stakeholder is someone who's interested in what you're going to say. So either a vested interest or a more elusive, more casual interest, but they're going to be interested in what you want to say. So in this case, those people will be your senior management team, your exec team, finance, because we're going to be potentially spending some money, procurement, equipment services. So make a note of who your key stakeholders are, who your interested parties, and then in your business proposal, your business case, you're going to be giving them the information that they're most interested in. So far we've got a driver and a bit about the technical use, and then what we're actually going to be using it for. And this is where people kind of start to sit up and take interest. When you're saying that you're looking at reducing the risk to patients of developing pressure ulcers. We wanted to use them, as I said earlier, before a patient's even developed any. We don't want to be reactive, and all too often in a lot of things that we do, we're reactive. So something happens and we react. We wanted to introduce this surface as a very proactive way of reducing pressure ulcers. So for us, our patients who've been on the theatre table for a long time, whose skin and tissues are under a lot of pressure for long periods of time, we found actually when we first started using this mattress is that there was some recovery in that acute post-op period that they were on this mattress. The daily hire charge. So most people who you're talking to are going to be interested in the cost. So this is the financial cost. So we put in what it's going to cost us to use the surface, and then as well as that, what costs we're going to save. And again, all too often when we're talking about introducing a new product, regardless of what it is, mattress or topical product, dressings or whatever, they might come with an initial increase in cost, an initial outlay. And we need to be, at the same time as including the cost, be talking about what costs are going to be avoided or reduced. And not just financial costs, of course. So again, these are extracts from our business case. What I'd very much do differently now is include the other non-financial costs. Of course, the other financial costs, litigation. And again, that appeals to some of your stakeholders, quite rightly as it should. But the cost to the patient. Where's Paul? Paul will describe, I'm sure, the cost to the patient. We've all seen the cost to the patient. We've never experienced it, however. So I'm sure Paul's talk will be very, very insightful for all of us, and a good reminder of why we're doing what we're doing and why we're trying to achieve better outcomes for patients under our care. And the pressure ulcer productivity tool, it's been around for years. Has anybody used that? It's a useful tool. Before I move on to that, your proposal is innovative. Unfortunately, we won't be able to use it because we've never done anything like that before. And what's the definition of insanity? Einstein's definition of insanity. You carry on doing the same things over and over again, but you expect different results. So we should always be, looking forward. What can we be doing differently? What could we be introducing services such as this at an earlier opportunity, which is what we did, or introducing something different that we've not done before. So the productivity, if you've not seen the productivity tool, as I say, it's been around for years. It's updated because times change, money, things cost more now. This was last updated a few years ago. You can put in all of your organisation's data or just bits and pieces of it. So you could put in at the top the total number of pressure ulcers that your organisation had last year, and you can also put in categories, or you could just put in the number of category 2s, the number of category 3s, etc. And it will give you an estimate of how much money could be saved by the NHS if you reduce pressure ulcers. So the bottom here is potential savings if the number of pressure ulcers is reduced. So you could type in, if you wanted to reduce your pressure ulcers by 10%, this is how much you could save based on your own data. So be familiar with your own data. Don't be completely data driven, but be familiar with your data and what it's currently telling you, and you'll be able to seek out some gaps where you can potentially improve. So we developed our own protocol because we've all seen this as well. So clinicians who will upgrade a mattress and then keep it there forever because there's some kind of safety and there's some fear in downgrading a mattress because, something bad's going to happen. So we wanted a protocol to help guide staff in their decision making. We can't take responsibility for ordering a Dolphin mattress for every patient out of hours. We do give, we're a little bit controlling. Some would say I am more than her, but we like to keep tight reins, don't we? We don't want people to go crazy, and staff would, in our organisation, if they could have a Dolphin mattress for every patient, they would have one. So we have to try and control this in some way. So we give them this so that they can order them out of hours, of course, if they've got a patient who fits this criteria. They're not needed for everyone. Of course they're not. Fear shouldn't drive us. Our clinical judgment should drive us. And it includes kind of that process of how we order and cancel a mattress. We have had some teething problems. We've been using them for 10 years. We still need to chip in every now and again and kind of, patient doesn't need it. They're skipping around the ward. They don't need a high-spec surface. So we do need to keep an eye on that. Our criteria is this. Yours might be very different. As I say, we have a lot of patients who are on the theatre table for a really long time. We have patients who have the chest left intentionally open, patients who can't be repositioned because they're critically unstable, patients who return to theatre. Now you might laugh at this one here, critical care. Patients with non-blanching erythema were very precious. We really are very overcautious. Talk about mollycoddle. So yours might be a bit of a higher spec criteria than ours. But overall, it's our highest risk patients. And clinical outcomes, so said at the start, it's very important to think about how you're going to demonstrate the effectiveness of the change that you've introduced. So, of course, you've got your pressure ulcer incidence, and your intention of introducing a new product or a new process is to impact on those patient outcomes. But we started to collect specific patient outcome data. It's a little bit earlier than January 22, it's the October before that. We are very fortunate that we have a support from a clinical advisor weekly. We also do a bit ourselves, though. We don't completely rely on the clinical advisor. But each patient who's nursed on a Dolphin mattress will kind of be reviewed with the tissue viability nurse to make sure that they are still appropriate. And we do have to, as I say, emphasise the importance of cancelling those mattresses and arranging collection promptly. Because a couple of days, it's unnecessary spend, and we do have to, it is a factor. We've not got limitless resource, and we do have to, justify our use of products. And our clinical advisor helps with the ongoing support and training for our staff as well. So this is just a snapshot of the data that was collected, our first data. So we use, as you can see here, 81% for patients who purely preventative. So high-risk patients, they don't have any skin damage, and nor did all of those patients develop any while they were on a Dolphin mattress. And then we did use 19% of our patients, we introduced the Dolphin reactively once they'd developed some skin damage. And of those, 11% healed while nursed on the mattress, 47% improved and 42% static. What influences those figures there is that the patients might be discharged before the pressure ulcers improved or healed. And we didn't collect that level of data, which is regretful, perhaps. But again, in summary, 100% of patients either healed or improved. So in terms of demonstrating effectiveness of a product, that clinical outcome data can support us with that. So in summary, review your local pressure ulcer data. Of course, with the new PSIRF, Patient Safety Incident Response Framework, we're encouraged to do that. And we're encouraged then to use that data to drive quality improvement projects. And this could be a very kind of good example or a good opportunity of such a QI project. Use tools to estimate the cost, but the financial cost. And remember the personal cost also. Consider the use of products, equipment, mattresses as a proactive way. So many people in the audience or online today might be responsible for actually driving the pressure ulcer strategy for your organisation. And compiling your business case, patient experience, patient stories, photographs, very powerful adjuncts to a business case. A couple of references, and I'll take any questions.